Don't let your clients bank on Medicare in retirement. But most of my clients are already on Medicare. So what can we do to help ourselves and my clients? How can we help you to kind of combat these high costs that this article talks about, along with the last video I did? I hope you folks saw it, about the Medicare drugs, Medicare Part B drugs, Medicare Part D drugs, and kind of the cost problems and affordability of said drugs. Well, in today's video, I'm going to talk about a couple of solutions you can have and how they can work and how they fit in with covering these more catastrophic costs on the Medicare program. So the first thing we're going to talk about is Medicare Part B. Remember we talked about Medicare Part B and how they cover drugs and how the drugs are kind of priced on a whatever the drug company tells us is what we're going to pay program, and how in other countries we wanted to try and match what they pay to kind of bring it more down to earth, because we pay 2 to 3 times as much as other countries do. Unfortunately, none of us can make that legislation happen. So what can we do to combat the cost of high Part B, right? So for Part B drugs, those are drugs that you take either by injection or in vitro, or not in vitro, sorry, intravenous or infusion. I'm not a doctor, so what can you do to combat the high cost? So what does it normally cost if you just have Medicare Part B? Well, Medicare Part B is, for those of you who need a little bit time to catch up, Medicare Part B has an annual deductible. This year, 2022, the annual deductible is $233, and the Part B co-insurance is 20%. So if a drug costs $10,000, your co-insurance after the $233 deductible is $2,000. Unfortunately, there are a lot of Part B medications that actually cost $10,000. What can we do to combat the high-priced Part B drugs? Well, the first and foremost way to cover these high-cost medications through Medicare Part B is obviously to purchase a Medicare supplement plan. Now, Medicare supplement plans can be purchased during your open enrollment period on the Medicare program, which is the 6 months following your enrollment to Medicare Part B. Now, how does this plan help? Well, this plan helps by, if you join a Plan G or a Plan N, your co-insurance for Medicare Part B services is $0 for Medicare Part B drugs. Now, Medicare Supplement Plan N does have co-pays if you go to the doctor office, which is up to $20. So when you go to the doctor office to receive that shot or the infusion, you could be expected to pay $20, but you wouldn't be expected to pay 20% of the shot. Now, what if you can't afford a Medicare supplement plan, or perhaps you simply can't qualify for a Medicare supplement plan because they're too expensive? Well, you should join then a Medicare Advantage plan that is a PPO. Now, why a PPO and why Medicare Advantage plan? Well, Medicare Advantage plans have a maximum out-of-pocket per calendar year. And as I said, some of these Part B medications can cost these $2,000 for each session. And the maximum out of pocket for most Medicare Advantage plans is as high as $10,000. And that's for utilizing services both in and outside of the network. Now, why a PPO? Well, PPO will allow you to go outside of the network and also doesn't require a referral. Many of these infusions and injections are done at specialist office. So if you are enrolling in a new plan and you don't have a referral set up with the new plan, then when you go to get that infusion or injection, your actual copay will be 100% because the insurance, the plan you join, didn't authorize that referral or that service. So a PPO will allow you to go to the doctor office, the specialist office, without said referral. Now, you might need an authorization for the medication, but at least the physician would be able to contact the insurance plan to get the prior authorization stuff set up. If you have an HMO, unfortunately, the physician, unless they have a referral from your primary care doctor, would not be able to really do much for you on the insurance plan. And it's a lot more difficult, I guess, for your doctors to work with the HMO. Part B isn't really the only problem. Part B really isn't a drug only system like Part D. So Part D, and many of the drugs from Part B are migrating over to Part D, unfortunately. Part D is run by private insurance companies. And these private insurance companies can restrict and put different pricing models and change the formulary pretty much in the year that you enroll without telling you and giving you any kind of choice. So what can you do to protect yourself from high costs of Part D? Well, if you watched that video I had just recorded and sent out probably the same day or day before this video came out, you would know that about 30% of Medicare beneficiaries do not pick up their first fill of cancer medication because cancer medications are very expensive. Therefore, cancer medication should be something that you think about covering. Now, there is no way to cover specifically cancer medication, but there is a way to cover cancer diagnosis through cancer insurance plans or cancer indemnity plans, where the plan, this cancer plan that you purchase, will pay you out X amount of dollars if you have a diagnosis of cancer, and then the policy will shut off. That's pretty much a one and done type of a program. Usually that's the kind that I like to talk about and I like to provide, because other types are usually not enough and sometimes a lot more expensive. So this type of policy will allow you to get access to fast cash in order to pay for the ridiculously high prices of cancer medication. Cancer medication is also one of the highest costs on the Part D drug plan. So I would say that the best way to cover the Part D problem would to be to purchase cancer insurance. And if you had questions about specifics for cancer insurance, I would need to send you the questions that they typically ask, because this cancer insurance is like regular health insurance where you need to health qualify. And also the rates that you pay are based on age, gender, and location. So I'm going to need your zip code, your age, date of birth preferably, and your gender, along with kind of an idea of how much you'd be willing to spend per month. I recommend purchasing a $20,000 cancer policy, just because cancer is said to reoccur. And a lot of times that first instance, once you get cancer, the policy closes, you wouldn't be able to qualify for cancer insurance ever again, or usually it's about a 10-year waiting period. So that's a long time to wait, and most times people get reinfected with cancer I've seen in as little as 5 years. So I would suggest getting something that would at least be able to cover you for 2 major incidents in bouts with cancer. So what about if you can't qualify for a Medicare supplement plan due to health reasons, and then of course possibly not qualify for cancer insurance? Well, there is one more option, and it's kind of like the option that this article recommends. This article recommends an HSA, which is a health savings account. It's a triple tax savings type account. It's tax deductible going in, tax deferred growth, and tax free coming out. Now an HMA is a little bit different. It kind of works like a time-based deductible savings plan, where in the beginning when you put money in, you actually get less benefit than the cash you put in. But as time goes on, you will get more than you put in. So we can take this chart here, for example. The more money you put in time-wise, the more money accumulates. And this health matching account kind of works where each month 10% more is being deposited based on your contribution amount. But not all the money that goes into this account is counted toward your contribution amount. 10% is matched to your contribution, giving you $110, and 10% each month goes up until you reach month 35, where, if all goes well, based on the calculations, you would have maxed out your account. And if you did max out your account, you'd only have to pay the administration charge of $40 per month to keep that $10,000 in there. Now, fortunately, it'll take you about 7 to 8 years to actually go back to one-to-one if you have spent or if you have contributed for those 3 years. So it's a pretty good deal. And it's something that I would suggest for people who are kind of a little more financially savvy, because as you can see, the growth rate of this account is quite high. You're pretty much getting like a 50% return over the course of the next 3 years. And that's really good. You're almost tripling your money by the end of that 36 months. But it's not without its problems. The first problem is you don't break even until 7 months in. So the first 7 months, your account isn't going to even keep up with your contributions. That can be kind of hurtful, or kind of feel weird when you're initially getting started. The second thing is you can only use the card, number one, in places that accept said type cards, Visa, point of service medical cards. And number two, you can only use them on these types of items. They have to be tax qualified for Section 213D, the IRS tax code. Now, most people are going to be spending a lot of money on these things. A lot of these things are necessary, things like dental, vision, hearing, things that Medicare doesn't cover. Also prescription drugs and any medical service. But that's still a limitation. And third, if you aren't able to use the card at point of service, you have to make a claim for reimbursement within 30 days of purchasing the item, and you have to keep the receipt, and you have to also file it on their website, which can be kind of hard for people who have trouble keeping track of everything and making sure everything goes in and dealing with customer service representatives on the phone. But the benefits are great as well. If you do wait that entire 3 years, as you can see, you basically are contributing like $4,000 to get a $10,000 benefit. And once you've reached that maximum point, let's say you spend a couple $100s 1 month, your 1 month of $140 contribution will max back up your account. So, you're pretty much getting $2 for every dollar you put in, as long as you wait long enough and don't deplete your entire account in one go. Like I said, it's a pretty good deal. Different from the HSA is the second benefit, and that's you are guaranteed to make some form of growth on this account. Unlike an HSA where you actually are investing in the stock market can go down, and the HSA, the account value of the HSA could go down as well. With an HMA, you're not investing it in anything. It is a health matching account that matches the amount that you put in. So you will quote unquote never lose money, and your amounts that you are given are guaranteed. And the last and probably most powerful reasoning why this account works for a lot of people is because you don't need to get underwritten for it. You don't have to health qualify. You also don't have to worry about being enrolled in a high deductible health plan like an HSA, and age doesn't affect anything. You could get this when you're 18, you could get this when you're 80. The amount you pay and the way that the structuring works is going to be completely the same, and gender-wise, completely the same. So with that said, it's both options, cancer insurance and the HMA, are pretty viable resources or tools to use, since Medicare isn't perfect. Now, if you want to learn more about either of these programs, let me know in the comments below. You can go watch a video on the HMA. I do have it down here. You can use my link to, again, enroll if you wanted to. That would help out the channel, help me out as well. But if you have more questions, please do let me know so I can provide more information to you folks about these types of programs. Now in the next video, I'll talk about Medicare Part A and how to get Medicare to pay for a skilled nursing home, as it's not guaranteed. You have to meet pretty strict criteria in order to get Medicare Part A to pay for your skilled nursing home. Also, you can check this video here where I talk about Medicare Part D and potentially how you can minimize your costs in it. Hope that helps. You guys stay safe, stay healthy, be smart. I'll see you in the next video.